Hi, I'm Dr. Vinatha. I'm one of the senior consultant at Cloud9 Hospital, Hyderabad. Today, let us discuss about recovery after hysterectomy. If you are someone who had a laparoscopic hysterectomy or an open hysterectomy or a vaginal hysterectomy, then this information is for you. So, what to expect after the hysterectomy? Once you come out of operating theatre, you might experience a little discomfort, you might feel vomiting sensation, but you might need a lot of rest. So the first few hours after your surgery, you will spend sleeping most of the time. But once you are awake and you are conscious, you might feel hungry. We will give you sips of water to take and see if you are not having any vomiting because of medications that were given during surgery. So if you are tolerating the fluids, we encourage you to get up as soon as possible and walk about. This will prevent clots in the legs or clots going up and blocking the lungs. So early mobilization is what we call, like getting up and moving early will help you in a long way. And once it is few hours, we will shift you from recovery into your own room where you can feel comfortable, where we encourage you every few hours to get up and walk around. And eating and drinking can be resumed in few hours. If you are not hungry, at least drink water. The moment you start drinking water and no vomitings, we can take off what is called as IV cannula that is there in the hand. So each hours like passed, you will come out of one of the things, so which will free you up a little. The moment a few hours, if you are passing urine after the removal of catheter, usually that happens within 24 hours. Sometimes you might have a pack inside the vagina that will also be removed within 24 hours. So by 24 hours, you will see yourself coming out of all the connections and free to walk around. In 2 days' time, most of the time you will be at home. So 24 hours after the procedure, once we free you up of all these connections, if you are passing urine okay and you pass wind, you are ready for a discharge from hospital. Of course, you will need painkillers for few days, usually given for 4 to 5 days following the procedure. When you go home, you will realize you also have some plasters on your tummy, especially if you had a laparoscopic surgery, or you have a big dressing on your tummy if you had an open procedure. But if you underwent a vaginal hysterectomy, you will not see any plasters on your body. The healing is all inside. If you do have plasters, don't worry, they are water resistant, waterproof. You can still have shower as soon as you can. Once you have the shower, you feel little better. Then these dressings sometimes can get a little wet, though they are meant to be water resistant. Don't panic if they get little wet. You can just take them off and put a band-aid or leave it open. You might have stitches or you might not have stitches. Sometimes we might use a staple, a stitch, or just the plaster to hold things, especially if it is a laparoscopic hysterectomy. All that doesn't need to come out. Some stitches get dissolved inside your body. Usually, we will call you after 5 to 7 days following the procedure to check on how this healing is happening. If they're all fine, we will leave the dressings off and keep the area dry and open. When you have a shower, you can use normal soap and water to clean the areas and dab the area dry. Keep them dry will help in healing faster and better. So if you develop fever or a lot of pain that is not going with the simple painkillers that you are given, or if you experience any foul smelling discharge, come to hospital. That is when you have to see a doctor to make sure there is no infection that is developing inside. If things go fine as planned, after this first week checkup, once you are home, make sure you are eating regularly and healthy balanced diet, drinking plenty of water. That will help you avoid constipation, avoid putting a lot of pressure on your pelvic floor, and that helps the recovery after hysterectomy. And usually we call you back around 6 weeks time, because it is very common for you to feel a little emotional and drained after the surgery. And it is very important that you get the support of your family and friends and stay positive during this time. At 6 weeks, we will check you and make sure that healing is all complete, and we usually advise you to avoid lifting heavy weights only till 6 weeks. After that, we encourage you to slowly resume all the activities that you were doing before the surgery. And we will also ensure that by this time you feel little better emotionally and support wise and ready to go back to work. If you are not, please speak to your doctor regarding the same. This is the time we also talk about if you need any further pap smears, because most of the time, if it is a complete hysterectomy, you will not need further pap smears. But if you require, depending on the reason for hysterectomy or the type of hysterectomy you underwent, this is the time we will tell you whether you require any further pap smears. And also, this is the time we talk about hormone replacement therapy if you need one. And by this, you will be almost ready to go back to your routine works at home and in your career. Following this 6 weeks check, we will tell this is the completion of recovery. Although most of the recovery happened, the dissolution of stitches inside might take a little more time, to a maximum of 3 months. But that will not hamper your healing. Your recovery is almost complete by the time you come to 6 weeks. Thank you.